You're ready.
Great. So, Turner, thank you so much for arranging for us to be with you and other members of the Glendale community. I'm Kathy Bray. I'm the president and CEO for Volunteers of America, and I'm with Sue Atabalu. You can see Yvette potentially up on the screen, but she goes by Sue. And so Sue and I are going to work together to provide you with some information about the 1875 South Redwood Road property that we just purchased. We're excited to become part of your community and want to share some information with you tonight. Sue and I have put together a brief PowerPoint presentation, and then that'll probably be around 15 minutes, and then we want to certainly listen to your questions, concerns, ideas. Turner's going to assist us with that, it sounds like, so that's great. And this is kind of the beginning of our conversation with the neighborhood. And so we're going to talk through a little bit about who we are as an organization, what our plans are so far for the Redwood Road facility, and then get into some detail with you about what we plan to bring to the neighborhood in terms of the counseling and treatment services. So let me just follow this outline. Hello, everyone who's listening, and thank you for taking the time to join us tonight. And Turner, again, thank you so much for hosting us. We're excited about starting this conversation with all of you. And again, I'm Kathy Bray. I'm the president and CEO for Volunteers of America, Utah. And I have provided also, and Sue, our contact information for any kind of follow-up conversations. And likely we'll have more conversations in future meetings because we have time for that. Go ahead, Sue. So just to share with you, Volunteers of America is a national organization dedicated to helping people rebuild their lives and reach their full potential. And across the country, we've actually been running in the United States for 125 years. And each year we help more than 2 million people in over 400 communities. We're in about 44 states. And so just to give you a little bit of an idea of the how much history we bring in providing human services and social services in communities across the country. And then we're the Utah affiliate. So I'm the CEO of the Utah affiliate, and our mission is to build a community-supported bridge that provides a path for those who are vulnerable to improve their lives and to increase their self-reliance. We primarily do that in 3 areas now, in mental health, addiction, and homelessness. So those are kind of our areas of focus. Right now, Volunteers of America Utah employs 325 staff. We operate 10 program locations in Salt Lake County, and we utilize over 3,000 volunteers a year, mostly in providing meals to people within our residential facilities. So that's a little background. And then to get more specific into the conversation for tonight, what we're providing on this slide is one of the real estate documents that we've been using as a resource. The facility that we purchased is at 1875 South Redwood Road, and many of you may know it as the Zions Bank Call Center. And so it's a 2-story light brick building, and it's quite large, actually. It's about 75,000 square feet. And we have some, Sue's going to talk a little bit more about our plans so far. These drawings are not our drawings. They're of the existing layouts that Zions Bank is using for their call center. And so what I want to share with you is a little bit of the timeline, like we bought the building recently, but we have a lot of steps to take still before Volunteers of America actually moves into the neighborhood. So I wanted to share with you timeline a little bit. So we are going to be hiring an architect in the next month or so, because we have to take a look at the space and reconfigure it in a way that meets the needs of Volunteers of America for the counseling and treatment type services that we intend to operate out of the facility. That'll take us some time to figure out. As a matter of fact, I should share that Zions Bank is continuing to operate from the building. So we bought it from them, but they still needed to use it for a little while they're remodeling another facility elsewhere. So they're actually leasing the property from Volunteers of America until the summertime. So they're going to continue the call center operations for 6 to 9 more months. And so there's some flexibility in when they're going to be moving, because they want to make sure their other place is ready. So that gives us some time to work with you, the neighbors, and to put plans together for how we can enter your community in the way that fits the best, and it gives us a chance to talk about what your ideas and questions and concerns might be. So we're happy about that. Then we'll have to do the remodel once Zions Bank moves out. I expect that we'll be doing remodeling like next fall, which would be the fall of 2022. And that at the earliest, I expect that we would be starting to move Volunteers of America business into the facility like next winter, and maybe even into the spring a little bit. So it just kind of depends on how long it takes to do the remodel and so forth. But that's kind of where we are in the time frame. Let's see. And so then Sue's going to talk a little more specific about what we plan to bring into the facility. So I'll pass it to Sue.
Thank you, Kathy. So we've been looking for quite a while for a permanent location or a permanent home for our administration offices, as well as our counseling center. We've had to move a couple of different times, and so we were really fortunate to be able to acquire the Zions Bank property so that we have that. So the intention is to move, like Kathy said, our administration offices, our counseling and treatment services, and our social model and withdrawal management services, which I'll talk more in depth about. And actually the social model and withdrawal management services is what we're seeking conditional use approval for. But just a little history on kind of our work with social model detox and withdrawal management. So we currently operate 2 programs. One is on the right, is our men's facility, which is in downtown Salt Lake in the ballpark area. That's been in operation for about 35 years, a little bit more than 35 years. Our Center for Women and Children has been in operation about 4 years. We operated it before for a number of years, and then it had to close due to funding issues. And so we were really grateful to be able to reopen it. A unique thing about that particular program is women that, single women can utilize the service, but also women that are parenting with children under the age of 10 can bring their children with them to detox. That's been a huge barrier for women that are seeking treatment services to have a place to bring their children, and then they can get connected to those treatment services. So just kind of a brief history on social model detox. So for folks that are coming off of alcohol and drugs, for many folks, they have a safe place to be to do that, to sober up. But for many folks that don't, we provide this service. So this is a non-medical facility. So people can come in, again, coming off of any substance or alcohol. And really the focus is primarily the first couple of days is their physical stabilization. So we have staff on board 24/7 to kind of monitor that process. We have wonderful partners in the medical facilities to be able to connect them to those services if that's needed. But for many folks, they just kind of stay in our program, get well, and then as they are getting well, it really is an opportunity for us to engage with them on connecting to different services. And as a detox facility, obviously treatment is one of our primary focuses with folks, as well as connection to the recovery community. And many of you may know Salt Lake County has such a wonderful recovery community. And so being able to connect folks to that is really huge. So we have peer support specialists and case managers on our staff that do that work. We're able to provide like 12-step meetings and other things so that clients can start thinking about what their next steps may be. Let me just... So the linkage and warm handoff to critical resources is so huge. As I think about detox, oh, sorry, was there a question?
No, go ahead. There was just some background noise.
Okay. As I think about the service we provide as a social model detox, it really is a connection to all these other services, whether it's behavioral health services, so into treatment, into mental health services. For folks that are still kind of on the fence on if they want to stop using, our harm reduction resources are critical, whether it's access to naloxone or Utah harm reduction with the needle exchange. And then also for folks, we have many folks that come into our program that are experiencing homelessness. And so that connection to the resource centers, to our outreach as they leave our program is critical, as well as coordination with other things. I think many folks, as they clear and feel better, they have a lot of things that they need to take care of, whether it's their legal issues, connecting with their family again, taking care of medical needs. We see a really high medical and mental health need as well. And so our partnerships in the community are critical for the services that we offer as well. For many folks, detox is the first step as they're thinking about, what to do next. And so we're grateful to be able to provide that. For those who don't know, as far as the stay there, clients can stay up to 30 days. In the past, it was 14 days, but with the pandemic, we were able to get approval from the county to increase that. I have been with the agency for about 13 years, and 12 of those years have been working with our detox programs. When I first started, it was so rare that someone can go directly into treatment from detox. But with Medicaid expansion and some of the benefits of Operation Rio Grande, there's a lot of feelings about Operation Rio Grande, but one of the benefits of it was access into residential treatment programs, and the expansion of that. And so now we're seeing more folks that we can stabilize in detox and go directly to treatment, which has been huge. Another piece I just want to mention really quick is connection with medicated assisted treatment. So in the past, we've had Project Reality has been our main partner, and we've been really fortunate to see those services expand. Now we work with the U as well in the Bridge program, Martindale with Odyssey House, Sacred Circle, and other providers that are providing that service for folks. So we're really grateful to be able to provide that to any of our clients that come through. And I think that's kind of us in a nutshell and what we provide as far as our services. Oh, wait, I think there's one more slide. I apologize. And I may have gone over a couple of these points. So target population obviously is individuals who recently used alcohol or drugs, 18 years or older. As we think about the Redwood Road property, we're thinking about maybe 150 to 165 beds, operated, monitored by staff 24 hours a day, 7 days a week. The recovery community and 12-step meetings are important. We'll be providing that there. That's client stay. another point we want to make, which is, I think, maybe an important point for folks in the community to know. So when people come into our program, they really, unless they decide to discharge, they really have to stay in the program unless they have an approved pass. So it's not this kind of in and out. Part of that is safety. Part of that is so that they can stabilize. And so, yes, so people are able to get approved passes, but mostly they'll be able to stay in the program. And then a critical piece, I think, that is important to us as we think about the Redwood Road property is transportation to services once people decide to leave. So we know with the resource centers, they have advantage services that provide that transport in between different resource centers. We're hoping to partner with them or to provide it as well back to resource centers or to public transit for folks so that they have a way, out of the property, if that makes sense. Kathy, do you have anything additional to add before we turn it back over to Turner?
Thanks, Sue. I just want to mention two things quick. One is that, with providing the detox services for like 35 years in Salt Lake, we've really had limited impact on the neighborhood. And there are several people and businesses that have been our neighbors for all that time, and some who didn't even know that we were there and until I offered to provide them a tour of the facility, for example. We are, and the other piece I wanted to share is that we are licensed by the state of Utah, and we have standards that we are expected to meet related to that licensure, and we have annual reviews with them. Finally, I would just say that we are part of the Salt Lake County Behavioral Health Network. That's where the funding for these services primarily comes through Medicaid billing, maybe some insurance billing, and then for people who don't have insurance or Medicaid at this point, there is some county funding through behavioral health that allows people without any resources to still get assistance through us. And so thank you so much, Turner, for the chance to provide this information to you and your community.
Thank you. Sue, if it's okay, I'm going to end the screen share. Oh, perfect. So for folks that are watching live, if you have questions, you can put them in the chat on Facebook and I'll ask them for you. Or if you're here on Zoom, we welcome you turning your mic and your camera on and asking your questions. I am going to start first with just a couple of questions. These were already addressed in the presentation, but I just want to put a fine point on them for folks. So first and foremost, this is not a shelter, correct?
Correct. It is not a shelter. It is not a homeless program. In fact, homeless resource centers are not allowed in the zone. So as we spoke with the staff at Salt Lake City Zoning and Planning, it is clear that having residential services such as behavioral health, like withdrawal management, is allowable in the commercial corridor, but homeless programs are not. This is not a homeless program.
Thank you.
Although we will serve some homeless individuals, but it is not specifically a homeless program.
Thank you. And you mentioned transit options. The area can be a little wonky to get to on public transit, but it sounds like you provide transit for your clients.
Yes, we don't at our current location unless we're taking people to different appointments. But we're also right next to tracks at the location in the ballpark area. So yes, that is a part of the plan for Redwood.
Thank you. And then are these services open to the public, or kind of what does the process look like for someone entering treatment or care with you?
Yeah, absolutely. For our detox facility, and I think Kathy mentioned, it really is open to anyone in Salt Lake County, regardless of their ability to pay. So if you have Medicaid, obviously we can bill Medicaid, but if you don't have an ability to pay, that shouldn't be a barrier in getting services. And so anyone in Salt Lake County really could access our social model detox services at even any of our other locations as well.
Thank you. there was a question that came in from James, who's a resident here, and he asked how your other facilities are connected with the neighborhoods that they're in. That's a paraphrase, but hope that I got to the spirit of what he was asking.
No, I think it depends.
Sorry, someone was calling me right when you were talking. Would you mind just repeating that?
Sure. It was a question from James, who's a resident here, and he just asked how your other facilities are connected with the communities that they're in.
Yeah, so I was going to just initially, and Sue, you may have some additional comments, but we have been, it depends on the type of facility, I guess, actually, but with community councils at times, and we would be interested in staying connected and participating regularly in the neighborhood community council. And I think we could probably do a better job of that in other communities as well. We do have some kind of advisory groups in some areas where we bring in local neighbors to have meetings with us on a monthly basis. And the other thing that we want to do too is we have provided sort of a liaison with neighbors so that if they have any questions or concerns about anything, that they can call us, and we would provide a staff liaison with a telephone number. What we did one time was we handed out magnets to the neighbors and can provide that number to the Glendale Neighborhood Community Council as well.
Thank you.
Mm-hmm.
And if I can just add to that, Turner, I think the Geraldine has taught us a lot. I think what Kathy was saying was true. We're lucky to be able to do those neighborhood community meetings. But I think there are many times when we're so just kind of involved in the work. But I think this gives us an opportunity, and I think we've learned over time that, how important it is to actually be integrated into the community well, and not just a service provider there. So I think this is a great opportunity for us to do that in Glendale. And so yeah, I think we're learning from past mistakes where we're just like, we've been here for 35 years, yet we haven't maybe been engaged as much as we should. And I think with such a needed service, I mean, substance use is such a pervasive issue just across the board. And so being able to be integrated in that way so folks will want to access services if they need it is really important. So thanks, James, for that question.
Thank you. I have two final questions, and then we'll turn it over if there's anyone here on the Zoom that has questions. What kind of volume of traffic or how many clients do you expect to serve at the facility?
Yeah, let's see. At the facility in Salt Lake City, we have about 80 beds there, and we serve 1,500-ish, between 1,500 and 2,000 people a year. But what I would say is that's based on the 14-day stays too. So I think it would probably, since we're moving to 30-day stays, it'll probably be around that number. I would think around 2,000 probably. It sounds like a lot, but people, will facilitate their transitions in and out safely. And there are that many people in our community who need the type of support that we offer there. So we're pretty busy. It's about 10 admissions a day is what we do at the downtown facility.
Thank you. And then the last question, this came in from, I don't think it's a real name, so I'm not going to read the name, but it was a question from a resident. Is there any connection between this facility and the proposed Other Side Village?
Not necessarily. We are certainly aware of the project that the Other Side Village and the Other Side Academy has been proposing. And because we also work in the homeless arena, we're participating in the Salt Lake Valley Coalition to End Homelessness. So we're aware of the project. We may refer individuals into the project, but not necessarily from this location. So what else would you say about that, Sue? It's like another nonprofit organization providing a service that will refer into probably.
Yeah, and my guess is that they would refer into our program as well. They have in the past. And so, so yeah, I apologize. I keep getting calls and missing Turner's questions. So I think it was about the other side academy or village.
Yes.
Just our association with the other side village is pretty limited, but we're certainly aware of it.
Thank you. So I'm at the end of my pre-prepared questions and questions that have come in on Facebook. Is there anyone here on the Zoom? I see Kimberly and an Amanda. Do either of you have questions that you'd like to ask? All right, it doesn't seem like it, and we're out of questions on Facebook. So Kathy, Sue, I'd just like to thank you for your time tonight. We'll have you back anytime that you want to come back. And then as kind of a final takeaway, I chair the Utah Harm Reduction Coalition, and I just want to speak to what a great partner Volunteers of America is and the great work that you do in the community. And we're excited about the work that you're doing and the potential for this project. So thank you so much for taking time tonight to come and visit with us.
Oh, thank you. That's good to know. And we appreciate the partnerships. And in full disclosure too, I would also like to say thank you, Councilman Ferris, for attending the meeting this evening. And Dennis Ferris is also a member of the staff of Volunteers of America. Thanks, everyone, and happy holidays.
Thanks so much for having us.
Thank you. And for those watching, we're going to go ahead and end the live stream. We will be posting a recording, and then we'll also make sure that a transcription is available in Spanish in the next week. So thank you all for your time tonight. Take care.
Thank you.